Often we don't know which course to take. Have you taken any courses yet in pediatrics, babies at all? Are you comfortable with handling babies or not? That's part of it too. And then, of course, where do you want to go with this? Typically, we start slow. That's understandable. So sometimes you just want a little bit so that you can dabble and just feel more confident in the babies that you do see. But sometimes people have a passion for it and they already know and they think that they might want to go really into this and then become a really important part of the community. We overlap our care now with dentists, lactation consultants, and midwives. So it's really exciting. Another thing to think about is what's your study style like? Do you prefer going at your own pace, dabbling in and out when you can on an online course, or also have an element of support? Because there are two options. These two options that have Zoom support, they give you access to the courses indefinitely, longer term, and you're actually saving money by getting all the online courses, starting with babies, birth injuries, treating the infant cranium, tethered oral tissues, intraoral treatment. And then you get the infant latch, jaw, and tongue course for free. None of the courses are very long. They're 2 to 3 hours each, and you get a certificate each time you complete one. You can always start the course over and review the material as often as you want. You can dive in and out of different courses to revisit whatever you're feeling, whatever you're going through at that time in your journey. And you get 3 personal Zooms with me, an hour to an hour and a half, and you get individual attention. You can schedule them whenever you want. One could be at the beginning, one could be in 2 years. It doesn't matter. Other offering is the Treating Babies Apprenticeship with Dr. Jonathan Evans, who's in Australia. He's a registered osteopath. He trained in the UK. And his program is very similar. He has a starting with babies course. He has all these parts to it. You do the online components. You're assigned chunks of them every month. And there's a monthly Zoom, but it's in a group of about 15 people. And that was a little bit more, but it's longer. And you get one certificate at the end for 40 hours. If you like group things and you want something more through 10 months to a year, you can opt for that. Balance how you might see yourself wanting some support. A lot of people don't have many babies to treat in a 10 to 12-month span. And sometimes the questions come later. And then the opposite end of the scale, if you just want a course to start with. So single courses, the access lasts 6 months. Bundled courses, so 2 courses that always go well together. For example, tethered oral tissues and intraoral treatment gives you access for 12 months. Those are the options. And then if you like this idea of becoming part of this kind of movement of osteopaths, collaborating with practitioners, and you're thinking about your longevity in the business because you get older and it gets really hard to treat adults. Babies are much easier. And once you get very used to handling babies, knowing their cues when they're going to start to fuss or agitate, you get good at nipping that in the bud and you get your job done fairly easily. And then you can charge appropriately. You're a specialist at that point. It's a nice way to have a practice. So here's starting with babies. Course synopsis right at the beginning. Here's your button to either start course, resume, or start it again. On the right side, there are sometimes some links to different things that are helpful to have. And then the description of whoever is the main collaborator or instructor. Video replays and resources is the section I'm in now. Sneak peeks and the quizzes are at the end. So let's just dive into video replay and resources. So each course starts with a little bit of information and then an outline. You'll see all the details of what's in there. And it's got lots of interesting, helpful downloads for an intake form and info cards that I had printed up for parents. It saves you a lot of speaking and it helps the parents because they get very tired treatment listening to all the information. So if you need a head shapes tips card, that's there. And I call it a graduation card. There's a graduation card that means when to visit me again. Bring it to me again when. In each course, you can put a comment. If you have a question, You can click in the comment section and post it. Then I get an email and I can answer you. There's often quizzes. You just click start now. It's never anything too complicated. They're kind of fun just to challenge you a little bit.
Hmm.
In this course in particular, so I put sneak peeks of all the other courses on there, just a little blurb about each one. Birth and its mechanisms of injury. So this one hosted Dr. Dustin Costaskew, and he's an OB/GYN at Hamilton Health Sciences in Ontario. Again, the course begins with what to do with your certificate, understanding the information in the course. Welcome to the course. I'm the instructor for that, but really most of the speaking is the guest speaker down here, Dr. Dustin.
Okay.
And here's all the contents: bony pelvis, normal birth, all of this awesome information, just enough that we need to know without getting too much into birth and having it be unrealistic and unhelpful if it's too detailed.
Right.
But mostly complications and the impacts on mom and baby. We go through all of that, breach, the different positionings, and then medical interventions. Really, that's oftentimes what makes babies so uncomfortable. Not
Yeah.
always. There can be a textbook perfect birth, but the baby comes out feeling pretty uncomfortable. Talk about C-sections, all these different things, and birth trauma, and a little bit of information on how midwifery and medical births work together. It's really interesting. And
Hmm.
again, here's the intake and birth history form in that course. Treating the infant cranium. Once you know how the injuries got there, to understand the special structures of the infant cranium. It's not telling you exactly how to treat because we know our principles, but
Hmm.
it does give you a little bit of a flavor and a certain viewpoint in what to keep in mind, because you'll feel something and what am I doing with that? What should I consider? Because this is not a small adult, it's a baby. Course outline. This was a webinar. The webinar was recorded and broken up into red flags, legal considerations, and some tips. The webinar is broken up into part 1, 2, and 3. And then
Right.
there's some resources at the end, my favorite books to have on hand, a few quizzes, and there's a video. It's in the TOTS course as well. It's treating the cranium. And I go through a mock treatment on an adult after the video, some the holds on a baby, because I
Right.
couldn't have a baby lie there for 23 minutes.
Yeah, fair enough.
Infant latch, the jaw and tongue. Put it together because other courses didn't dive into the jaw specifically and what the jaw is doing in terms of latch problems. So we talk a
Right.
lot about in the other courses about under the tongue and different things like that. But this one breaks down muscles of the jaw and what's happening to the mandible, things that are very specific. This is very watchable and easy to digest at any time. But this one I think is a good one to get back into once you've treated babies for a while, because we can't keep all the detail in our heads all the time. And course synopsis, the red flags, and then here's the video of the presentation that we had. And if you don't want to repeat looking at these sneak peeks, but you want to trigger your certificate, you don't need to go through all of these. Let's say you bought all the courses, just scrub through them, run them through so they triggered as complete. A little quiz at the end,
Yeah.
wrapping things up. This would be a course that's given to you for free if you get that whole package, which, by the way, that package is called Supported Learning Experience. There's tethered oral tissues. This one's longer. This one's a little longer. It has all the staging of what tethered oral tissues are, how they're handled. It goes into some of the anatomy and physiology, just to refresh everyone's memory, just so we're on the same page, how dentists look at tongue ties and how they're staged and when to refer out, what that might look like, what that might feel like, so that you're not beating yourself up about something that's actually a surgical case. Diving into what happens if there's poor oral function, what happens to that child's development and problems later on in their life. This is where my passion lies.
Hmm.
Osteopathy time, taking an intake, discussing something brief about birth injuries, and that big 23-minute demo videos right here. Because it's on an adult, I throw in the handling and positioning on a baby in photographs right after, and how to assess the oral cavity, some tidbits, but We get into that meat in the intraoral course. There's also a free tutorial about tethered oral tissues, and it's 1.5 hours, and it's all to help you digest all the things you see and the things you feel. It makes a lot of sense when it's just explained to you. You don't have to figure it all out.
Yeah. Yeah, that's the thing, right?
It's years and years and years. It's just, and that's why these courses are good to have indefinitely, in my view, because you do forget and just put on a headset. You don't have to necessarily watch it all. You could just be listening again while you're chopping vegetables, meal prepping for the week, whatever you're doing, go for a walk and get that information back in your head. Lastly, for babies, intraoral treatment, there is a small quiz to start you off. It just sets the scene, lets you realize where are you at right now.
Hmm.
Answers that question, are OMPs allowed to work inside the mouth? A lot of people don't think we are, but we are. It's not illegal as long as we don't go past the larynx, which we're not going to do.
Yeah,
Course
yeah.
outline is very detailed. And here's the anatomy. We get into the tongue, specifically about maxilla and hard palate, that tethered oral tissue staging. That's a little review from the TOTS course. This is the great part about the course: assessment, treatment, and framework. It's all a flow chart. It gives you something to start with so that you don't feel like there's this teeny tiny mouth in front of you and you don't know where to begin. What should I concentrate on? What am I trying to do here?
Right.
So this is very helpful. And then gloves and positioning, communicating with parents because we want to speak a certain language so they don't get too concerned. Case studies. So Olivia, Boyd, Adeline, Chloe, Garrison, and Mia all have slightly different things going on. They're not long each per se, but I play them twice and I say, watch this, watch it once, and then we're going to watch it again where I talk through some things. Here's referring out. It's just really good to be able to know like what you're saying, where you're sending them to, when you should refer out, when you should have them back. Interesting info, helpful info. A little quiz at the end to help you realize how much more you know. Resources. And this replay tutorial is the same tutorial in the TOTS because it's so relevant to both. So if you
Okay.
wanted to scrub through it because you just watched it, you just scrub through it. Just so you know, there's assessing pregnancy and
Yep.
tracking pregnancy. You can read about those online on the landing pages. If you're interested in helping a mom get through that pregnancy more comfortably and understanding what all the broad ligament is doing, the round ligaments are doing, and how that's the driver of the mother's postural considerations and fluid flow and all of that. So those are there as well.
So the homework caseload isn't really a homework caseload. It's kind of get through the videos and do your self-study along the way.
Yes, you need to structure yourself a little bit more if you did Treating Babies Apprenticeship with Dr. Evans,
Right.
but it's still not hard to fit in because we only meet once a month. It's just a different timeline and a different rhythm. Some people really just have different things going on in their lives and they want to approach this differently and have that one-on-one support. So that would be the SLE, supported learning experience with me. So I hope that answers some of the questions. It gives you a little bit to think about. And
Hmm.
if you have any more questions, just let me know.